Hi, I'm Adrenergic blocker and this is my biography. My drug name is Adrenergic blocker and under my drug name are the different generic and brand names. This is my chemical name. My therapeutic drug classifications are antihypertensive to prevent the complications of high blood pressure, antianginal for treatment of angina pectoris, antiarrhythmic to suppress abnormal rhythms of the heart, adjunctive therapy of migraine, and myocardial infarction. My pharmacologic drug classification is a beta blocker, which means I work as by blocking the effects of the certain hormones such as epinephrine and adrenaline. My pregnancy category is category C. Animal reproduction studies have shown an adverse effect on the fetus and there are no adequate and well-controlled studies in humans. But potential benefits may warrant use of the drug in pregnant women despite potential risks. For my mechanism of action, the epinephrine and norepinephrine bind to B1 receptors and increase cardiac atomicity as well as conduction velocity. B1 receptors also induce renin release and this leads to an increase in blood pressure. In contrast, binding to B2 receptors causes relaxation of the smooth muscles along with increased cardiac metabolic effects such as glycogenolysis. For my pharmacokinetics, it is divided into 4 parts, which are absorption, distribution, metabolism, and excretion. For my absorption, all beta-adrenal receptor blocking drugs seems to be rapidly and completely absorbed from the gastrointestinal tract. The rate of absorption, however, appears to be lower in elderly patients and possibly also in patients with renal failure than in younger patients. Next is distribution. The beta blockers so far studied are rapidly distributed in the body. The distribution ranges between 5 to 30 minutes. The apparent volume of distribution varies 3 to 4 folds between the compounds, but in all cases, the apparent volume of distribution exceeds the physiological body space. After distribution is metabolism. In general, lipophilic beta blockers are metabolized in the liver, whereas hydrophilic agents are eliminated in the kidneys as unchanged drugs. Lastly is excretion. Beta blockers are mainly eliminated by renal excretion or renal route. For my indication, beta blockers as a class of drugs are primarily used to treat cardiovascular diseases and other conditions. Beta blockers as a class of medications are essential drugs and are first-line treatments in many acute and chronic conditions. For my contraindications, beta blockers should not be used in patients who have caine-induced coronary vasospasm because there is a significant risk of unopposed alpha receptor activity which would worsen the vasospasm. Patients who have either acute or chronic bradycardia and/or hypotension have relatively contraindication to beta blocker usage. Specific beta blockers are contraindicated depending on the patient's past medical history. We have side effects and adverse effects of the cardiovascular system, which are hypotension, bradycardia, and heart failure. In the central nervous system, we have anxiety, hyper or hypoesthesia, and impotence. In the GI tract, we have vomiting and abdominal pain. In the musculoskeletal system, we have back pain and joint pain. Lastly, in the respiratory system, we have pharyngitis and wheezing. In the nursing responsibilities, before administering beta-adrenergic blocker medications, we have to check the vital signs check for allergies, obtain health history, establish baseline physical assessment to monitor for any potential adverse effects. The nursing responsibilities during the administration of medication. First is to monitor the heart rate and blood pressure closely and frequently for changes so that we can anticipate the need to discontinue the drug if adverse reactions are severe. Second, institute safety measures to prevent injury if the patient experiences weakness, dizziness, or orthostatic hypotension. Lastly, provide comfort measures to help patient cope with drug deficits. The nursing responsibilities after the administration of medication are: monitor the patient response to therapy. Second, evaluate the patient's understanding on drug therapy by asking the patient the name of the drug, its indication, and adverse effects. Lastly, monitor the patient's compliance to drug therapy.